CDC emphasizes that now that there is an authorized and recommended COVID-19 vaccine available, accurate information is essential.
COVID-19 vaccines will not give you COVID-19.
None of the COVID-19 vaccines currently available in the United States use the live virus. The vaccine that is currently being distributed is the Pfizer-BioNTech COVID-19 vaccine, which is an mRNA vaccine. mRNA vaccines give ourselves instructions for how to make a harmless protein that is unique to the virus. Our bodies then recognize that protein should not be there and builds lymphocytes that will remember how to fight the virus that causes COVID-19 if it is infected in the future.
COVID-19 vaccines will not cause you to test positive on the COVID-19 viral antigen tests.
Most rapid coronavirus tests are antigen tests. Antigen tests are immunoassays that detect the presence of a specific viral antigen, which implies a current viral infection. After immunization, your system will build up antibodies, signaling an immune response. Therefore, after immunization, an antibody test may turn positive. The COVID-19 vaccination helps to protect you by creating an antibody response without having to experience the actual sickness. The vaccine will help prevent you from getting sick from COVID-19.
People who have already had COVID-19 may still benefit from getting vaccinated.
Antibody response from having the disease, known as natural immunity, varies from person to person and has not been shown to be long-term. Reinfection with COVID-19 is still possible. Therefore, everyone should receive the vaccination.
2 doses of the vaccine are needed.
A second shot 3 weeks after the first shot is required to get the most protection the vaccine has to offer against serious disease.
After the COVID-19 vaccination, you may have some side effects.
This is a normal sign that your body is building protection. The side effects from COVID-19 vaccination may feel like the flu. Symptoms such as low-grade fever, body aches, and fatigue. They should generally go away in a few days and are not serious.
U.S. regulators are recommending that those with a history of anaphylaxis consult with a physician before receiving the vaccine.
The Pfizer vaccine is made up of mRNA and 4 lipid nanoparticles and does not contain preservatives or other ingredients. The Pfizer study showed that there was a 0.63 or less than 1% incidence of serious adverse reactions to the vaccine. This number does not include patients who have a history of anaphylaxis. Those patients were excluded from the study. So again, U.S. regulators are recommending that those with a history of anaphylaxis be seen by their doctor prior to receiving the vaccine.
Vaccine doses purchased with U.S. taxpayer dollars will be given to the American people at no cost.
Although the United States government is trying to limit the cost of the vaccination providers may charge a small fee for the safe administration of the vaccination. COVID-19 can have serious, life-threatening complications, and there is no way to know how the coronavirus is going to affect you. If you get sick, you could spread the virus to your friends, to your family members, to your coworkers, and other people in the community. Stopping a pandemic requires that we use all of the tools available to us. The vaccine will help people fight the virus if exposed. However, social distancing and wearing your mask are still essential parts of preventing the spread of the coronavirus. It is important that we all do our part to stop the spread of misinformation that erodes confidence in the coronavirus vaccination. Instead, we must strive to educate ourselves about the facts of the vaccination, which improves people's confidence. Facts, not fear.